From downtown Scranton, this is Northeast Current. WQPX invites you to join us as we explore public affairs, current events, and arts and culture in northeastern and central Pennsylvania. Now, let's meet today's guests on Northeast Current. Hi, and welcome to this week's edition of Northeast Current. I'm your host, Tony Schwartz, and we have a very interesting topic for you this week, very important topic that a lot of families need to talk about from time to time, and we're going to find out just about how to go about that today. We're talking about hospice care, and we're here with Lisa Kirby.
Hi.
Lisa, welcome to the show.
Thank you.
You are from the Commonwealth Hospice of Northeast Pennsylvania, correct?
That is correct. Yes,
and where are they located at?
Our offices are located in Scranton, our main offices. We also have a branch in Wilkes-Barre and Kingston. But we serve patients and their families in the surrounding communities, going out to the Montrose, Susquehanna County, down through Luzerne, out to Lake Ariel region. So we cover a great span, even though our offices are in Scranton. So
anybody who might be in need of hospice care, it's not necessarily just for the Scranton city proper area.
That's right. That's correct.
Reach out
Absolutely.
To Northeast Pennsylvania.
Definitely.
Tell us a little bit about hospice care.
Hospice care. You know, basically hospice care obviously deals with somebody who has been diagnosed with an end-stage disease. Often there's, you know, a negative connotation to the word hospice. Sure. In the community, people are, you know, oh my goodness, it's a hospice kind of thing. We don't want to deal with that. Death is not something that's often welcomed. We try to fight it as much as we can. But really, hospice is to offer comfort. When you are in an end-stage situation, and technically through Medicare, what it means is if your physician feels that if your diagnosis proceeds in a regular course, you have 6 months or less to live with it, then you would be eligible for a hospice program. And, you know, none of us are God, so it is a best diagnosis as possible from the physician. We certainly do have patients that go beyond 6 months, and we have patients that we graduate them, meaning they've been referred to our program, we bring them on, we help manage their symptoms, we may monitor their medications, we bring in social service support and things like that, and we stabilize the patient. Their disease just stabilizes. And at a certain point, we say, you know, you no longer qualify for hospice, and it's okay, we can graduate you from the program, we'll keep in touch, you know, God bless, goodwill, you know, all that kind of good stuff, and they keep going. And then, you know, at times they'll come back on our program.
So it's not always the beginning of the end.
Not necessarily.
Not necessarily. Mm-hmm. That brings two questions to mind for me. Number one, if you feel you or a loved one needs hospice care, you are not the one that actually calls hospice. You need a referral from a physician to get into the hospice program? Actually,
you're kind of right in a couple of different ways. Yes, ultimately we do need a physician order, and we need to have the physician satisfy, you know, the requirements, the certificate of illness, terminal illness. But at the same time, no, you can call. If you have a loved one and you want to see if hospice might be the right time for them, you as a family member or even the patient themselves can call and inquire about it. And we can certainly help assess the situation and things like that. Ultimately, to get on the program, though, we do need a physician's validation, physician's order to approve it.
Okay. And the other thing that struck me interesting to me is that I know a few people who have had hospice care, including my mom, mm-hmm. Some years ago, and it seems that the hospice care was always called in like at the last 2 or 3 weeks.
Right.
And you're talking months,
yes.
Up to 6 months. So,
right.
Tell me a little bit about that. Where's the confusion there?
Really great question. I think some of it's an educational thing from both, you know, broad spectrum, from individual citizens, from you and I, understanding what it really means. And again, asking the basic question, well, how do I find out about it? Who can call? It's all informational, you know, just knowing yourself. And, you know, we try to encourage, we've had workshops and seminars in the community to try to have people, encourage people to start talking about their end-of-life desires and wants before you're in crisis mode. We had partnered with Caring Connections. It's part of NHPCO. It's a National Hospice Palliative Care Organization. And, you know, it's designed to say, let's talk about this before you're in crisis mode. Because when you're in crisis mode, it's so much harder to sort things out, especially with family members and you're having different opinions and things like that. So part of it is educating the community at large. And I think the other part is the medical establishment. You know, doctors have taken an oath and their desire is to save their patients. And there's certainly nothing wrong with that, and that's a great thing. But at some point, too, it's understanding there is just nothing else that can be done, and giving them the options. You know, early on to say, let's talk about where we're at. My dad, I started back with our hospice program back in 2011. Within the first week that I came back, my dad actually, he and I chatted, and he had COPD. And he had been in and out of the emergency room at different times. My sister was a nurse, did a great job taking care of him. But at that point in time, there were no other options. And he and I chatted, and ultimately a decision was made. And he was on our program for almost a full year. And in that time, did not go into the emergency because of breathing episodes. But at the same time, while he was on, he did come down with a little bit of pneumonia, and he opted that he wanted to be treated for it at that point in time. Pneumonia is not uncommon with COPD, which is the lungs, it's your breathing. So he did go in. He did come off our hospice program. He did get treated for it, and we were able to enjoy his company for several more months after that. So it's not something where you can do that often once you've enlisted hospice. The idea is that once you're on it, you're kind of thinking that you're okay with this. But at the same time, you have the option to make some choices.
So an important mindset for the folks out there then is to always keep in mind, be aware that don't necessarily sit around waiting for somebody to mention hospice to you. Start inquiring ahead of time about it, because it might be beneficial to you rather than just waiting for those last 2 weeks.
Exactly. That's a very good point.
Okay.
Yeah.
Obviously, there's a lot of paid, trained professionals within your organization, but your organization is also made up of a lot of volunteer work, isn't it?
Definitely.
Tell us a little bit about the volunteers.
Okay. The hospice program itself actually was started as an entirely volunteer basis. So when its origin, Dame Cicely Saunders was really kind of given some credit for getting the hospice movement underway. And so volunteers were pretty much the whole program. And there are still programs that are out there that are all volunteer basis. In the 80s, I believe it was, in our country, Medicare got involved to get insurance payments and things like that in order. When they did that, they made a requirement, and we're one of the only programs under Medicare that the participation requirement is to have 5% of your staff care hours equal in volunteer care hours in a given month. So it's regulated. We are required to try to fulfill volunteer hours in our program. And so that's part of the connection to the volunteer effort. In part, it was, I think, to honor the spirit of how this whole program got started. And the other part was to have some financial benefit to the program. Hospice programs often, whether they're for-profit or not-for-profit, it's not really, a money-making kind of opportunity.
So now when we're talking volunteers, we're not talking about, although this is a very important aspect of it, we're not talking about people who just volunteer to go by a house and say, how you doing today? I mean, they have some responsibilities, right? Is there some training involved for volunteers?
Yeah.
What is some of the things they go through to learn?
Yes, good question. I mean, basically, I say we treat our volunteers are treated like employees except for the paycheck. Even from the very beginning, you go through an interview process, there's background checks, drug screening, they have to go through TBs and training. And so it takes a good 5 to 10 hours just to get up to speed. And that includes shadowing somebody who's been experienced with volunteering as a hospice person or shadowing myself, just to make sure that everybody is comfortable and the expectations are really in line with what they're looking for. Now, we have a 10-bed inpatient center in Scranton on the regional hospital campus in the old part of the hospital. And so often we get our folks started there because we have staff there. I'm there. And so if there's any hiccups or questions or concerns, it's a little bit more supported. Once they are comfortable with that, then we will assign them to a patient in their personal home, nursing home, personal care home, wherever the need might be. So training is provided. Expectation-wise, it can vary. They can certainly do sort of task kind of things. They can help with mail. They can help with making a small light meal, light housekeeping, dusting, things like that. Maybe getting the mail, running to the grocery store, those kind of things. By and large, a lot of them really are there as heart companions. I kind of look at it that way. They are there. There was a book written about the American Book of Dying, and in that book, the author talked about the Celtic culture, how they were kind of, again, beginning of life, end of life. It was part of the cycle, and it wasn't so feared. And they referred to somebody who walks with you in your life journey as an anam cara, as a soul friend. So I've often shared that with our volunteers. They are really a soul friend to that patient and to that family. Because sometimes they'll be sitting with someone who may not be responsive, but the family member is the one who needs their heart to share with. and so they'll communicate. So sometimes it's just being with someone, not necessarily having to do something.
That's important because, you know, the person that's out there who might be considering volunteer work or saying that's not for me, may be painting the wrong picture of what's required of them. And so I think it's important to make that clear. They're not administering meds.
Correct. That is true.
The volunteers.
Correct. We even don't even encourage them to offer to pass the pill to them. We just, you know, we kind of just do like a hands off on the medications as best possible. So they will be there though if they need some support to walk from one place to the next, things like that. You know, minor washing of a face or of hands, minimal body care. But no, they're not looked at as a nurse or as a certified nurse's assistant and things like that.
See, that could scare someone off.
Right. Good point.
So if you had to put it into words, for the person out there who's looking as volunteer work with hospice as a negative thing, you put that positive spin off. Tell them why they would want to do it, what they would get out of it. It's not always about what the patient gets out of it.
Exactly.
It's about what's rewarding to you as well. I mean, talk about that a little bit.
And that's a really good insight. And I think that's one of the things that I often hear with our volunteers. It is so much an honor for them to have that moment to walk in that person's life story, to hear them share their life stories, you know, to look at family photos with them, to connect with fond memories. You know, I had an opportunity to recently visit to fill in with one of our volunteers with a lady who was on our program for quite some time. Unusual the length of time that she had with us, but she was just a beautiful spirit. And I was so honored myself to have been able to sit with her, to listen to her stories about travel. She was originally from Wales. We talked about this time that she went to a floral market and how it stuck in her mind, the White Cliffs of Dover, you know, things like that. You're connecting and having these moments that, you know, you really walk away feeling like, definitely, I am the one who has received something. I don't know if I've offered anything, but I definitely walked away with something. And so I think that's one thing I hope that people would understand. And I think the other fear is, what am I going to do? What do I say? Or what happens if they die in the moment that I'm there? And that has happened with our volunteers. And, you know, I've often said too, because one of the concerns is what happens if I start crying? You know, that's the other concern, because you're having this moment and the person may get tearful. And I think if you can share a tear with someone in that moment, it's a beautiful gift to both people. That I often say too, you know, but if it's at the point where you continue crying and the patient is now caring for you, you may have gone a little too far. But it's you know, it's a sharing experience, and you're definitely right. Our volunteers walk away with a lot from this process. And we do have, you know, if they're concerned that maybe they're not sure about the idea of sitting with somebody just yet, certainly we have administrative volunteer needs, you know, helping with patient records, filing, scanning, office work, and things like that. And all of that counts toward that 5% volunteer time. You know, there's also efforts where we don't count the time, but still need some volunteer support. We have community breakfasts, outreach breakfasts for Easter and for Christmas. And so we just offer it to the community. Anybody can come and attend. And we have Mr. and Mrs. Claus. And I tell everybody we have the real deal because we get Mr. and Mrs. Claus.
Oh.
So, and it's just a fun thing. We just collaborated with Endless Mountains this past winter, in addition to having it at our regional hospital. And we actually helped raise some money for noteworthy organizations in the community. So we're trying to do different things, and volunteer support. A lot of students help at those kind of events. So there's different things that people can help out with in our program.
Something tells me you haven't done hospice work your whole life.
You're correct.
What got you started?
Very good question. Initially, what happened was I was living with, we moved back to the area. We were living with my grandmother and had lived with our in-laws, my in-laws at the time, for a little while. And I witnessed different types of end of life. I had my in-laws who had both different levels of dementia, but physically amazing stature. And then my grandmother, whose mental ability was amazing, had some physical ailments. You know, so we kind of experienced both of that. And with my grandmother, we were actually in the hospice unit when she took her last breath. And so I actually got to see the benefit and the care that she was given, and the beautiful experience of being in that moment with that person when they were, you know, when they kind of transitioned over and left this side.
So you were inspired by others who were caring for your family at the
Definitely,
time.
absolutely. And then the opportunity came where, at that time, it was Mercy Hospice, and they had a volunteer coordinator position open up. and a friend of mine recommended me, and that was the start of that.
Well, I know we're just about out of time, unfortunately, because I think we could talk about this a lot more.
Absolutely.
So we have to have you come back someday in the future.
Thank you.
But if someone thinks that they have a loved one that's in need of hospice care right now,
Yes.
or if they think they want to be a volunteer, how can they contact you or the organization?
Great. If they are looking for information regarding a loved one, the number would be 570-961-0725. That's our general hospice number, and that they would help process their questions or concerns.
Say it again.
570-961-0725.
And it's magically appearing on the bottom of the screen right
I
now
love
as you're saying.
technology.
It's amazing.
It's a great thing. And then my number for volunteering to get me directly is 570-348-7372.
Well, Lisa, I want to thank you for stopping by today and talking with us and the folks at home about a very important topic that needs to be discussed, not only here but in our homes from time to time. So we hope you come back again and chat with us some more.
Thank you, Tony. I would love to come back.
Sure, absolutely. If you know of someone, or maybe it's someone in your own family who's in need of hospice care, be sure to call those numbers you saw on your screen. Or maybe you know someone in your community who needs some help like that, be sure to pass this information on to them. We thank Lisa again for stopping by and visiting with us. Don't you go away, because we have more of Northeast Current for you right after these messages.
That one.
Sure.
Don't be so thrilled.
I was on a roll too.
He's good.
This was
He's
like
good.
Emmy stuff
Yeah, I
here.
know.
Can we talk now? All right. Is there a website or anything?
We do have Commonwealth Health on the, I just lost the address. Isn't that nice? Commonwealth Health Systems.
We'll edit that out then.
And here's why, because the website's not that great for getting information, so I kind of stumbled on that one.
Now we're definitely editing
so
it
now
out.
you're going to definitely cut that whole scenario right out of there.
All right, let me...
And not only that, we were able to submit the questions. So like he was using our questions, so I kind of knew what you were going to ask. But yeah, and I walked in and I was nervous and I was like sitting on the edge of the chair and I'm like, am I okay to sit like this? He goes, no, you want to sit back. But there's like, this is so nice because you are talking back and forth.
Ryan Leckie.
Well, and the other thing with
It's a wrap.
Thank you. Is that all right?